Hello. Hello, everyone. Hello, everyone. I'm back. I'm Irene from Infection Control, your host for today. Would like to continue my second part of topics discussion regarding infection control and precaution during COVID-19 vaccination. The last time I ended on the part of hand hygiene monitoring, and this being hand hygiene coordinator, I have a daily dashboard to send the report as daily and then monthly evaluations. The next, for the section 5 of infection control regarding monitoring, is the easy clean consumption, your microbiological culture monitoring, biological monitoring of sterilizers, monitoring during constructions and renovations, temperature, humidity, air change, monitoring in the special areas, monitoring of kitchen, monitoring of laundry, safety measures, microbiological water analysis every month, and who are the concerned department regarding of this monitoring regarding water analysis is your dental department, and then housekeeping and cleaning, regular pest control should have. Today is February 4, and I will finish this today. In section 6S, regarding our staff health in IPC program, you have screening regarding your pre-employment, initial assessment, staff immunization status, sharp and needle exposure management, exposure to potentially infectious material management, post-exposure management of healthcare workers, sharp injuries, infectious diseases, pulmonary TB, HIV, hepatitis B, varicella, chickenpox, measles, mumps, rubella. And the vaccinations immunization, your HEPA A, HEPA B, varicella vaccine, MMR, DPT, other vaccines are as indicated. Work restriction for sick healthcare workers. The pregnant healthcare workers. Staff satisfaction and productivity. Psychological counseling. Infection control in staff accommodations. Now we are in section 7 for our LPC program. Infection control activity in special areas. What is that? Unit 2, what prevention of surgical site infections. This one of your surveillance. And then management of MERS scope and NCOV and triads at your emergency room. I said activity in special areas, especially now. Infection control and physiotherapy, respiratory therapy care, infection control in laboratory, collection and transport of specimens, management of biohazard waste, care of vulnerable patients, comatose patients, your elderly patients, also your concern regarding infection control in pharmacy, your intravenous admixture, storage condition and stability guidelines of vials, storage of medications, and antibiotic utilization guide. Okay, for follow-up and monitoring infection among the staff, employee with signs and symptoms of communicable diseases should not have contact with patients, should be educated to report any significant infectious illness to their supervisor and the staff member responsible for employees' health, and must be documented in the file. Employees with infectious disease must be isolated in a dedicated isolation room. Health employees contact with infectious case must be referred to staff health doctor for prophylactic treatment. Develop protocols for managing employees and exposure. Sorry for the interruptions. I'm back on my ring from Infection Control Department. I would like to continue this topic, precautions during COVID-19 vaccination sessions. Infection prevention and control precaution. We are now in the precautions during COVID-19 vaccination sessions. During COVID-19 pandemic, care must be taken to protect people from getting infected. So during vaccinations, several precautions should be followed, such as your universal masking policy for all healthcare workers and patients is followed. Activate daily monitoring for healthcare providers before starting their work. And if any symptomatic or suspected patient should be isolated as soon as possible. You need to promote adherence to the respiratory hygiene, cough etiquette, and hand hygiene among everyone in the facility. Maintain physical distance between patients at the waiting area. Utilize electronic communications as much as possible. Utilize electronic communications as much as possible. For specific detailed storage, handling protocols for individuals' vaccines products, always refer to the manufacturer's product information and contact the manufacturers directly. Always use aseptic technique and follow infection prevention guidelines to prevent microbial contamination and infection. These include the area for vaccine preparations, prepare the vaccines in a clean designated medications area, away from the patient and from any potentially contaminated items. Prepare each dose immediately before administering. Do not prepare several syringes in advance. Ensure the availabilities of the following in the preparation area. Facilities for hand hygiene, puncture-resistant sharps container accessible at point of use, a dedicated medications vaccine refrigerator, second, pure hand hygiene. And I was discussed this since on the first part of my topics. Healthcare personnel should practice proper hand hygiene using an alcohol-based waterless antiseptic hand rub or wash with soap and water before vaccine preparations, between patients when changing gloves, and at any time the hand becomes soiled. Hand washings with soap and water is recommended if there is visible contaminations with blood and body fluids. Personal protective equipment, face masks are recommended for all healthcare workers. Take note, N95 is not recommended. Your face shield is recommended only in area of substantial community transmissions. Otherwise, it is optional. Gloves are not required unless the person administering the vaccine is likely to come in contact with potentially infectious body fluids or has open lesions on his hands. If worn, perform hand hygiene and change gloves between patients. The gloves is optional for subcutaneous or intramuscular vaccines, but they are recommended for intranasal or oral vaccines. Equipment. Healthcare personnel should ensure their clinics has the supplies needed to administer vaccines, including sterile single-use needles and syringes, alcohol swab, cotton balls, and hygiene supplies, personal protective equipment, sharp and medical waste containers. Also, MOH-approved low or medium level disinfectants should be available. It is must to use a sterile syringe and a sterile needle for each injection. Check the integrity of every package before use. If the needle or syringe package has been punctured, torn or damaged in any way, it should be discarded. Excuse me. Always check the expiration dates on the vaccine in diluents because some syringes and needles have expiration dates. So check those too. Expired vaccine diluent or equipment should not be used. The vials are discarded immediately when sterility is questioned or compromised. Open vials are discarded according to manufacturer's instructions. Preparation of the vaccine. Perform hand hygiene before preparing vaccines. Follow manufacturer's instructions for the storage and use of the vaccine. Before starting the injection setting, clean the preparation surface with 70% alcohol and allow to dry. Prepare vaccines only when you are ready to administer them. The person preparing the vaccine is the one who are responsible for giving it. The diaphragms of the vials are scrubbed using friction and 70% alcohol. They are allowed to dry for inserting a new needle and syringe. Take care not to touch or contaminate the rubber membrane or opening after disinfecting it. Use sterile needle and syringe to reconstitute each unit of vaccine. After use, place the syringe into a sharp container. A needle should never be left in the vaccine vial to be attached to a new syringe. While single-dose vials are intended to be punctured once for use in one patient and for one injection. Multi-dose vials that contain more than one dose of vaccine can be punctured more than once using new sterile syringe and needle each time, taking care not to puncture it with a used needle even if it was not being used on a patient. New sterile syringes and needles should be used for each injection. When in use, if the needle has been damaged or contaminated, in any way by touching any of its parts, the shaft, bevel, or adapter, it should be changed. If the adapter or plunger seal of the syringe was touched, it should be discarded and a new sterile one is used. When filling a syringe, never enter a vial with a previously used syringe or needle. Never mix different vaccine products in the same syringe to obtain full dose. Never transfer the vaccine from one syringe to another. Skin preparation of patient before injection. Skin that is visibly soiled or dirty must be washed. Disinfection with disinfectant is not recommended before vaccination unless the manufacturer recommendation state otherwise. Avoid touching the injection site or the needle tip. If the needle touch any non-sterile surface, it should be discarded. If the site bleeds after injection, a clean swab can be used in it. Management of shot injury. The supervisor must be informed immediately of if any shot injury occurred. The injury must be taken care of appropriately and follow-up should be done. Needle sticks are preventable. There are simple steps healthcare workers can follow to reduce the risk of needle stick injuries, such as avoiding recovery of needles and other hand manipulations with used needles. If recovery is necessary, for example, the injection is delayed because the patient wants to ask any question. Use what you will use. Use one-hand scoping technique to recover it. Manual removal of the used needle from the syringe is avoided. Used needles and syringes must be placed in a sharp container that is present at the point of use. It is puncture and leak-proof. Close the sharp container securely when it is 3/4 full, and then it should be transferred to the waste storage room where it is stored until transferred outside the site. The size of the sharp container must match the size of the workload. Empty or expired vaccine vials are considered medical waste and must be disposed of accordingly. Your environmental cleaning. General rules must be followed to maintain a clean environment. All the surfaces in the area must be cleanable. Floors must be cleaned daily at the beginning and the end of the shift. In case of contamination and visible dirt during work, immediate cleaning and disinfection must be done. The materials used for cleaning and disinfections must be approved by MOH which includes alcohol 70 to 90%, chlorhexidine with alcohol, quaternary ammonium compound wipes or sprays, newly diluted sodium hypochlorite solutions 1000 ppm, Liquid quaternary ammonium compounds. Correct contact time and concentrations must be followed. Cleaning the environmental surfaces is an important disinfection and it must be done first. It is necessary to have blood and body fluids spill kits available. All staff should be trained on how to use it. Cleaning is done from clean to dirty surfaces and from high to low points. Gloves should be worn by housekeeper while carrying out the cleaning process. If there is a risk of splashing, eye protection, clean glove, and surgical mask should be used. Hand hygiene should be done after finishing the cleaning process and removal of personal protective equipment. Medical waste must be handled the right way using the appropriate supply that is available in sufficient amount and sizes. They should be available and easily accessible at point of use. Your supply needed. Rigid puncture-proof and leak-proof containers. Rigid puncture-proof and leak-proof containers with biohazard logo. Waste collection yellow box. Match the required thickness that should be tear resistant. Leak-proof with biohazard logo. Sub-block plastic ties to tie the waste box. All reused needles and syringes are discarded in a strap container that is present at the point of use. Needles should be recapped or directly manipulated by hands to avoid what? Needle stick injuries. HAW, this is for you. Waste are properly segregated. No infectious excuse me, medical waste or sharps are observed outside its specific containers. Empty or expired glass vaccines vials are considered medical waste and must be disposed of accordingly. They should be discarded in shell containers. When the shell containers or medical waste bags are three-quarters full, it is securely closed and transferred to the waste storage room. The waste storage room is located away from the traffic and other services with a clearly visible biohazard symbol, where the medical waste is stored until transferred outside the site every 24 hours for final disposal, according to national regulations. Okay, let's continue. The floors, walls, and ceilings of the waste storage room should not contain any cracks. The surfaces of the room should be made of materials that withstand rebuild, cleaning, and disinfection. Medical waste is collected at fixed time, without delay, and on demand using a suitable size leak-proof container with biohazard logo and with tightly closed lid. It is transported in closed and in purviews specified carts with biohazard signs. The carts and containers are cleaned after each use or at least daily. Collection and transportation of medical waste are done by allocated workers. Wearing proper PPE. They should be trained on hand hygiene, use of PPE, safe handling of waste, and vaccinated against bloodborne pathogens. Our references is from the CDC's interim guidance for immunization during the COVID-19 pandemic, and you can online resources like CDC gov/vaccine pandemic guidance, and this will help to you the awareness of pandemic COVID-19 services during the COVID-19 pandemic, COVID-19 vaccine training, general overview of immunization, the best practices for healthcare providers. I'm talking about regarding the references that Infection Prevention and Control Department, the ebook of www.publichealthontario.ca. And this will help to you the awareness regarding our vaccinations. I will end my topic now, and maybe on the next 2 days I have another uh, discussion lecture here with the presence of the housekeeping participants. And then I will discuss to them the staff orientation regarding housekeeping. And sorry for the sounds, it's not good. Okay, I will come back soon after 2 days. And thank you for watching. See you in another video.